My name is Kate Rowlands and I come from UK, and I've been working with Le Chêne de l'Espoir from 2005, both in the French hospital as the director, the French Medical Institute for Children, and then latterly since 2007 with the Children's House and the education project which Le Chêne de l'Espoir have been running in Kaboul. So to access all, children from all the provinces in Afghanistan for specialised medical care. The FMIC provide very specialised medical and surgical care that is not available in other parts or in other hospitals in Kabul or in the country. The hospital has a welfare system in place, so the poorer are able to access the hospital service, but there are many people who cannot even afford welfare payment, very underprivileged and socially compromised, economically compromised families whose children need care. So the Children's House project and job is to access these children from all the remote areas in Afghanistan, also the urban areas, the poorest of the poor, to provide free of charge medical treatment for these children, medical and surgical treatment for the children, to provide the logistic ability by providing transportation for the patients from all over the country, and we provide a house where their children and their parents can stay during treatment. And the house is a very lovely place because we have all the ethnic groups from Pashtuns, Hazaras, Uzbeks, Tajiks, Nuristanis, all sharing a place in the house, the fathers, the mothers, the children. There is no politics, there's no discussion. They're so friendly, they learn about each other's cultures, and it's just a lovely place to be. And it gives a chance for the children to understand other cultures and other ethnic groups, so it's really a nice place, Well, in 2013 we actually in terms of operations, we actually provided 820 children had surgeries funded by Le Chêne de l'Espoir, although a lot more children came through the house for follow-up treatments or for medical treatment, so. And we've now total since the beginning of the project assisted over 3,500 children to access specialised medical care. A large percentage of the children that we are referred to as are orthopaedic cases with complex pathologies, and scoliosis, curvature of the spine, or just different orthopaedic clubfoot, osteomyelitis, which has been untreated. We have a lot of orthopaedic cases, but we also treat, we have many cardiac children for open and closed heart surgery referred. We have general surgery, visceral general surgery, and also many children who come for plastic and reconstructive, for treatments of cleft lip and palate, and very commonly for plastic reconstructive surgery for children with burns. We have many of those type of children. In 2014, the project from the start in 2008 to 2013, we more than trebled the amount of children that were being referred to us on a monthly basis. So in addition to the children who are newly referred to us, which averages about 80 a month for treatment, we have also children from previous treatments that come back for further surgeries, follow-up treatment, etc. So The house is actually we've outgrown the size that we have at the moment. So this year is very happy news, because we're starting building of the new children's house, which will provide a facility for over 100 children, to be children to be referred, and also have the capacity for our old children coming back for further treatment. So we're really looking forward to that. Okay, I've been in Afghanistan probably about, I don't know, about 15, 16 years, something like that, this last time. And I've seen a lot of, obviously, over that period of time, I've seen a lot of changes happening, both politically and within the health sector. I think many advances have been made in the health sector, and I think the Ministry of Health is doing its best, to provide as it can and to develop its services. But unfortunately, in the rural areas, where a lot of our work that we do with the house, with the children, many of the rural areas remain very, they lack in some areas most basic health care, and for sure it'll take a lot of time, I think, to continue to develop them so that it covers the country.